The fluorescent lights in Bayview VA Medical Center hummed just loud enough to be annoying. They buzzed, flickered, steadied again as if the building itself was tired of being awake. Riley Hart counted the flickers without meaning to. 1, 2, 3 between the elevator and the ER doors. The habit had started in a field hospital on the other side of the world where every flicker might mean the generator was about to fail. Here it was just old wiring and poor maintenance. Her left leg caught for half a step and sent a thin bolt of ache up her hip. The brace inside her scrub pants clicked softly. She shifted her weight, adjusted, kept moving. The automatic doors slid open with a breath of cooled air and antiseptic. Noise hit her like a low wave. Monitors beeping out of time. A television in the waiting room murmuring about coastal storm warnings. A man coughing wetly behind a privacy curtain. Somewhere a cart squeaked every third turn of its wheel. To most people, Bayview's ER would look like chaos. To Riley, it was a map she knew by muscle memory. Trauma bays lined along the far wall, nurses stationed in the center, anchored by a ring of computers and 3 sad plastic plants. Supply closet tucked behind a door that never closed right. She moved through it with a slight hitch in her gait, the kind that drew eyes. They slid off her face and landed on the brace outlined under her scrub pants on the subtle drag in her step. Then they moved on. Almost. As Riley passed the corner where the residents liked to cluster, their voices dipped, then rose again on the edges of a joke. "Is she still on trauma nights?" one of them whispered. "Liability waiting to happen, man," another replied. "Wait till she drops a patient on the way to CT." They laughed under their breath, not cruel exactly, not kind either. Riley's jaw tightened. Her hand drifted toward her left thigh, fingers pressing through fabric to the ridge of the scar there. For a split second, she felt the cool weight of something that no longer hung there. Purple metal on a frayed ribbon. It had knocked against her leg every time she ran through sand. She had shoved it in a drawer the day she signed her discharge papers. "Morning, Hart." The voice pulled her back. Casey at the front desk handed over a clipboard without looking up from the screen. Her hair was twisted into a knot that had seen better days. "You're early," Casey added. Riley glanced at the clock on the wall. She had misjudged the traffic on I-5 and the line at security. Or maybe she had just needed to be here where things made a different kind of sense. "Couldn't sleep," Riley said. "What have we got?" Couple of walk-ins. One chest pain waiting on labs. Orthopedic still hogging Bay 2. Dr. Pierce is already in a mood. "Is he ever not?" Riley asked. Casey huffed out a quiet laugh. "Careful. He might hear you. He has bat ears when it comes to his own name." As if summoned, a tall man in a white coat rounded the end of the nurse's station, scrolling on a tablet with one hand coffee in the other. Dr. Logan Pierce looked every inch the polished attending he wanted to be. Dark hair just messy enough to seem intentional, sleeves rolled up to reveal forearms that drew lingering looks from some of the younger nurses. He saw Riley and his mouth curved almost like a smile. "Hart," he said. "Good. You're here. You can handle the paperwork." He stepped sideways in front of her, blocking the computer she was about to log into. The motion was casual, practiced, as if she were another cart to be navigated around. "I'll need vitals listed in the notes on everyone in Bay 3 to 7 before rounds," he continued. "Keep the phone close. If anything acute comes in, I want the more mobile nurses on it." There it was, more mobile. Riley kept her eyes on the screen behind him even though she could not see it. "We rotate trauma assignments, Dr. Pierce. It's on the schedule." "Schedules change," he said lightly. He took a sip of coffee. "We adapt. It is what medicine is all about." His tone was almost playful. If she pushed back, it would become mock-offended surprise. He was good at that, making sure he sounded reasonable while she sounded difficult. In her head, an image flashed and vanished. Sand. Smoke. A man screaming in 2 languages. Her own voice hoarse from shouting orders over the roar of helicopter blades. "Medicine is also about knowing what your staff is capable of," she said. Logan's gaze dipped to her left leg. "Just for a second. Just enough." "Exactly," he replied. Before the words could land the way he wanted, another voice cut in. "Hart." Dr. Elena Ward stood at the end of the station with her arms crossed. Her hair was threaded with gray and pulled back in a simple knot at the nape of her neck. She wore no makeup, and her badge was clipped to an old lanyard with a faded Army logo. "We got that chest pain moved to observation," she said. "I want you to check the guy in Bay 4. His wife says he has been short of breath since yesterday. You know how to tell when someone is lying to keep the copay down." Riley turned toward her. Ward's eyes held hers for a beat. A subtle flicker there. "You all right? Do you want out of this conversation?" "I'm on it," Riley said. "Actually, Logan started I was just assigning Hart to." "I already assigned her," Ward said. "You going to reassign me too?" Silence stretched. Logan's jaw worked once, then he lifted his coffee and smiled like it was all a joke. Of course, doctor, he said. Wouldn't dream of it. He pivoted away, coat flaring slightly, and called out to another nurse, Garcia, you're with me on trauma. Hope you stretched. Riley watched him go. Her shoulders dropped a fraction. Do not waste energy on that. Ward murmured, stepping closer. You will need it for people who are actually bleeding. Riley's mouth twitched. He wants me off trauma. He wants to feel taller, Ward said. He thinks stepping on you is the way to do it. You let him talk. You let me handle the rest. Riley nodded once. Yes, ma'am. Do not ma'am me, Ward said. It makes me feel like I am back in Kuwait. Riley followed her down the row of bays. Curtains swayed with the air conditioning. Smells layered over each other. Bleach sweat, the metallic tang of blood-stale coffee. At Bay 4, a middle-aged man with a neat mustache sat hunched on the gurney, his hands clasped over his chest. By the time she finished checking him over, slipping questions in between jokes about hospital food, she had a pretty good idea how much of his story was true. Enough to worry, not enough to call a code. She left notes in the chart that were more detailed than anyone asked for. She worked through the next patients the same way. Steady rhythm, hands sure, pivoting around her stiff left leg in a dance she had perfected over 3 years here. At the nurse's station, someone had pinned a small piece of paper to the corkboard. Riley recognized the handwriting before she saw the name. It was a quick sketch of a bird perched on a branch. Fine lines for feathers. A tiny eye that looked more alive than it had any right to on printer paper. Underneath, in looping letters, you still fly, you just do it differently now. E. Emma liked to send art instead of texts when she thought her sister was ignoring her calls. Riley reached up and pulled the note down. The drawing smudged slightly where a thumb had pressed too hard. She has talent, Ward said at her elbow. Riley startled. She had not heard her approach. She keeps applying for summer programs, Riley said. I keep telling her we do not have the money. Ward made a soft sound. Kids find a way, or they do not. Our job is to keep them alive long enough to figure it out. Riley folded the paper once and slid it into her pocket, pressing it flat against her leg. The outline of the bird lay over the old scar like a thin shield. Behind them, a television above the waiting room chairs flickered to a local news segment. The sound was low, closed captioning crawled along the bottom. Safety concerns arise over outdated boiler systems beneath historic buildings at Pacific Coast University. The words tugged at the edge of Riley's attention. She glanced up in time to see a grainy shot of red brick and limestone in old library set back behind oak trees. A maintenance worker in an orange vest pointed at a cluster of pipes. Should have been replaced years ago, the caption read. Someone at the desk changed the channel to sports. A different crowd of patients murmured about a game instead. Riley turned away. Bay 5 needed a new IV. Someone was yelling about their pain meds. A printer jammed and beeped insistently. She had 3 hours to go before lunch. 10 hours before the end of her shift. An entire lifetime between one step and the next, it sometimes felt like. The overhead lights hummed on. She adjusted the weight on her left leg and walked back into the noise. The call came just after 10 in the middle of a blood draw. Riley had one gloved hand braced around a skinny forearm, the needle just under the skin, when the overhead speakers crackled to life. Attention! Mass casualty incoming from Naval Base Coronado. Multiple critical traumas. Estimated arrival 12 minutes. The words rolled across the ER in a flat, recorded voice. For half a heartbeat, the whole room seemed to hold its breath. Then it exhaled. Chairs scraped. Someone cursed quietly. A monitor alarm jumped as a nervous patient jerked his arm. Riley steadied the needle, taped the line in place, and forced her own pulse back down. That sounds bad, Pune. Yeah, sad, the man on the gurney said. He was in his 60s, still wearing a Padres cap, paper gown, gaping at the back. His eyes had gone wide. We have room, Riley told him. You are not going anywhere. She labeled the vial, double-checked the wristband, and handed the sample to a tech, already half jogging toward the lab chute. Overhead, the voice continued. All available staff to emergency department staging, all elective procedures on hold. Casey was on the phone to bed control. The clerk in registration started shooing relatives back into chairs, raising her voice, only when one woman insisted she had to stand right next to triage just in case. At the far end of the unit, the big red light above the main doors began to flash. It washed the white walls in intermittent color, an artificial heartbeat pulsing against plaster. Riley peeled off her gloves and tossed them. Her hands moved on their own, reaching for a fresh pair as she walked. Mass casualty protocol, Ward called out, voice cutting through the noise without needing amplification. Logan, you and Garcia clear bays 1 through 4. I want trauma carts, prepped airway equipment, checked chest tube trays ready. Heart start staging bay 5 through 7. Pull every unit of O negative we can spare from the blood fridge. Should we divert ambulances from the city? Someone asked. We are the diversion, Ward said. The Naval Hospital will be saturated. Riley pulled back the curtain in Bay 7. The bed was occupied by an elderly vet who had come in with dizziness and stayed for observation because no one trusted his blood pressure. Mr. Harlan, she said, keeping her voice calm, we need this bed for a moment. I'm moving you closer to the nurse's station. His faded blue eyes blinked up at her. That bad, huh? It is busy, she said. You know how it gets when they bring them in from Coronado, he grunted. I was on that base in 72. Their training exercises were bad enough then. She unhooked the monitor leads with fast, careful fingers, wheeled him out, and parked him near the station where Casey could keep an eye on him. Behind her, Logan was already moving, though his movements were sharp in a different way. He snapped orders more than he spoke them, tone-pitched just high enough for everyone to hear. Where are the anesthesiologists? Someone call radiology and tell them to clear CT. Who is on call for vascular tonight? I want them here now. Garcia hustled beside him, pushing a cart, trying to keep up. Riley pushed the empty bed back into Bay 7, locked the wheels, and began checking what the last shift had left in the drawers. Gauze airway adjuncts, extra monitor leads. She pulled out anything extraneous and dumped it in the hallway. Travel light, she muttered. Her heart had started its own rhythm quicker now, not panic, something else. The same adjustment her body made when a helicopter had used to thump overhead and the radio crackled with coordinates. Heart. Ward appeared at her shoulder holding a tablet and a stack of blue trauma gowns. She tossed one to Riley. Base just called, Ward said. They were running some kind of live fire training. Something went wrong. We are looking at blast injuries, possible burns, shrapnel. They do not have a full count yet. Any chemical exposure? Riley asked. They say no. Ward raised an eyebrow. They also said the last 3 ranges had been inspected. Your guess is as good as mine. Understood. Once they arrive, I want you at the head of Bay 5, Ward continued. You run airway and lines. We will let the residents feel smart giving orders as long as they stay out of the way. Logan is not going to like that, Riley said. Ward snapped on her own gown. He can file a complaint, preferably after no one dies. The sirens began as a faint whine somewhere past the parking lot. The sound grew picked up by others. Different pitches, different distances. An approaching chorus. The veterans in the waiting room shifted in their seats. One man in a faded Marine Corps hoodie stared at the ceiling, jaw clenched. Another scratched his arm and asked no one in particular if anyone else smelled smoke. Riley moved to the blood-fridge fingers already counting units in her head. Her limp felt less obvious when she was moving quickly. The brace inside her pants became background noise. Her hands knew what to do, so her mind could focus on what was coming through those doors. O negative on top. O positive next. Plasma in the back. She loaded coolers, stacked them, shoved them into position near the empty bays. Behind her, Logan's voice rose again. Why is Bay 2 still occupied? I said clear it. If Ortho wants to babysit their post-op knee, they can do it upstairs. Riley glanced over. The young nurse in Bay 2 looked trapped between the post-op patient and Logan's scowl. Ward stepped in without breaking stride. Bay 2 is mine. You have 4. Use it. Logan opened his mouth, closed it. The red light caught his profile in pulses, carving hard lines into his face. The first ambulance backed up to the dock with brakes that squealed in protest. The doors flew open before the wheels had even stopped rolling. The sound changed again. Corridors that had held only the ordinary noise of a busy ER filled with new layers. Gurney wheels rattling over thresholds. Boots on tile. The steady, controlled rush of paramedics giving rapid reports. Male early 20s blast injury to left side. Decreased breath sounds on the left, BP 80 over 40 oxygen, sat dropping in spite of high flow. Female 30s, multiple lacerations, possible internal bleeding, pupils equal but sluggish. We have given 1 liter NS en route. The air grew thicker with the smell of road dust, burned fabric, and something metallic that cut through even the antiseptic. Riley stepped into Bay 5 as a pair of paramedics swung their gurney around. What have we got? She asked. They were already rattling off numbers, abbreviations, vitals. Riley listened and moved at the same time. On 3, she said. 1, 2, 3. They slid the patient across to the hospital bed in one smooth motion. He groaned as his injured side hit the mattress. His face was gray under the grime, a streak of soot running from his hairline to his jaw. Riley leaned over him, voice close to his ear. You are at Bayview. You are safe. We are going to help you breathe. His eyelids fluttered. For an instant, unfocused eyes met hers. The fear there was sharp and bright, but not unfamiliar. She had seen that look in desert nights and in the back of armored trucks. Name? She asked. His mouth moved. She caught only a rough syllable. It is all right, she said. You can tell me later. She glanced at the monitor as it came to life above his head. Heart rate high, oxygen low. Need a 15-liter non-rebreather, she called. Prepare for possible needle decompression if sounds do not improve. One of the residents hesitated until he noticed Logan watching. Then he scrambled to obey. By the time the second and third ambulances arrived, Bay 5 and 6 were full. In Bay 7, Riley had started a second line on a woman whose uniform was scorched across one shoulder. The smell of burned fabric clung to her like another layer of clothing. "You are doing great," Riley told her, though the woman had not said a word. Her teeth were sunk into her lower lip hard enough to leave a white mark. Logan swept past the foot of the bed. "We need more imaging orders," he said to no one in particular. "I want CT on every chest injury stat." Ward appeared again, tablet in hand. "We will prioritize," she said. "We do not have unlimited CT slots, and we have not even seen the worst of it yet." "You do not know that," Logan said. "I have been in more mass casualty events than you have been to conferences," Ward said. Her tone remained even. "Riley breath sounds." The woman's chest rose in shallow, uneven movements. Riley pressed her stethoscope to the unburned side, then to the other. She frowned. "Decreased on the right," she said. "Trachea slightly deviated." "Tension pneumothorax," Ward said. She looked at Logan. "What do you want to do, doctor?" For a second, Logan froze. His eyes flicked to the monitors, to the woman's face, then back to Ward. "Chest tube," he said. "We will get her to surgery." "In 10 minutes, she will not need a surgery," Ward replied. "Heart." Riley was already reaching for the kit. Her hands did not shake. The world narrowed to the triangle of skin between the clavicle and the second rib, to the feel of bone under her fingers. "On my count," she said to the nurse holding the woman's arm. Logan started. "You cannot perform that without my order." "Then give the order," Ward said. There was a pause that felt too long. "Proceed." Logan said the word dragged out, but he said it. Riley pushed the needle through. The resistance of tissue gave way to a sudden release. Air hissed out a rush that brushed warm across her knuckles. The woman's breath eased almost at once. Her shoulders sagged a fraction. The monitor numbers ticked in a better direction. Around them, the ER kept moving. More sirens, more boots, more voices calling out ages and injuries and blood pressures. Riley removed the needle, secured the catheter, and taped everything down in quick, neat lines. She did not look up. If she did, she might see the way the residents were watching her now. She might see Logan's expression as he realized who had just saved this patient in front of him. Instead, she focused on the next breath and the next line and the next wound. Her leg ached. Her back ached. None of it mattered. The red light over the doors pulsed on and off, washing the corridors in color. Outside, more sirens approached. Inside, Bayview's ER shifted itself to make room. The fourth ambulance rolled in harder than the others. The back tires screeched as it swung toward the dock, and even from inside Bay 5, Riley felt the shift in the room. A current of attention. Paramedics moved faster, voices sharper. Someone muttered that they needed more stretchers. Someone else whispered a rank, though Riley could not hear which. Ward met the gurney halfway down the corridor. Riley caught only fragments of report, at first drowned out by the commotion everywhere else. Male, blast radius, lost consciousness en route, unstable. Then another word drifted back toward her. Seal. Her body stilled. Only her hands kept moving, finishing the tape on a line for the woman in Bay 7. When the last strip was pressed flat, Riley stripped off her gloves and stepped out of the bay. The corridor felt narrower. The red light above the doors flashed in steady rhythm, catching every bit of motion in its subtle strobe. For a beat, Riley wondered if her leg would hold under her if she took a step forward. The ache pulsed through her thigh, but her muscles tightened in ways they had been trained to tighten. She walked. The paramedics swung the newest arrival into Bay 3. The crowd pressed in behind them. Residents climbed over one another to get close. Logan raised his voice, ordering people to clear space, though he did not move aside himself. Ward stood at the head of the bed, eyes narrowed, already assessing the wound pattern. Riley felt her heart climb to her throat before she saw anything more than the top of a uniform sleeve. There was sand-colored fabric torn and soot-stained patches half burned off. The man wore the remnants of gear that had once been heavy. Now it lay like shed armor. Someone stepped aside. Riley's breath hitched. Captain Cole Rivera. His face had always had a hard edge carved by sun and grit, and the relentless need to look alert even when sleep was a luxury. Under the ER lights, he looked washed out, features sharpened by blood loss. His dark hair was matted on one side. A thin trail of dried blood ran from temple to jaw. His chest rose in uneven pulls. Monitors beeped a jagged line of numbers that told their own story. He had a pressure bag on one arm and a set of half-taped IV lines on the other. Sweat clung to his skin in a dull sheen. Riley stepped closer without thinking. Ward turned slightly, her voice cut through the mess. Heart. Here. Riley took position opposite her, sliding into a space that had not been cleared for her, but seemed to open the moment she arrived. She placed her hand at the side of Cole's head, stabilizing his airway while Ward adjusted the mask. Cole exhaled in a rough, broken sound. His eyelids fluttered. Riley leaned in. She could see the exact instant his vision focused. The exact instant a fogged battlefield memory found a shape in the stark white light. His gaze locked on her. She did not breathe. Cole's lips moved, first barely forming sound. A whisper was all he could manage, but the word was unmistakable. Nightingale. A quiet fell around the bed. Not full silence, but a soft void, the kind that forms when too many people stop at once. Logan frowned. What? Ward's expression did not change, but her fingers paused for a fraction of a second before continuing her work. Nightingale. A name that did not belong here. A voice she had once dragged through smoke and sand. A voice she had not heard in 3 years. Riley forced her own voice steady. Captain Rivera, you are in Bayview VA Medical Center. You were injured. Stay with me. His eyes stayed locked on hers like he was trying to confirm something no one else could see. His breathing hitched, then steadied under the mask. His hand twitched and Riley moved her grip to keep him from pulling at the lines. Ward addressed the room. We need imaging. Prepare for a fast exam. Get the surgical team on standby. Residents scattered, grateful for orders. Logan hesitated, then stepped back to make space he had been unwilling to give 5 minutes ago. The words spoke themselves around Riley as she watched Cole. She saw the recognition still flickering there, saw the way it steadied him, pulling him toward consciousness with effort. She remembered him shouting coordinates through a cracked radio. She remembered dragging him while her own leg burned with shrapnel. She remembered the valley, the bodies, the sky thick with dust. A medic approached with a portable ultrasound. Could you lift his side a little? Riley adjusted her stance, bracing her left leg carefully. Her fingers slid under Cole's ribs to help shift him just enough for the probe. Cole winced, jaw clenching. Sorry, Riley murmured. His eyes flicked to her again. He tried to speak, but Ward shook her head. Save it, Ward said. You can talk when there's more blood in you. Cole made a low sound that might have been a laugh if it had not been half swallowed by pain. The ultrasound screen showed murky pockets of fluid. Ward gave a tight nod to the medic. Prep for OR. Logan jumped in, then eager to reassert something. We need labs, airway, full trauma panel. And somebody page vascular again. Why are they not here yet? Ward did not look at him. They will be here when they are here. Hart, keep his head steady. Riley kept her palm against Cole's temple. It felt too familiar. The angle, the weight, the careful pressure so he would not strain his neck. She could feel the faint tremor in his muscles through her glove. His gaze drifted toward the overhead light, unfocused, now strained. Then it dropped back to her. This time the whisper was clearer, shaped by breath and memory. You're alive. The words almost undid her. Something in her chest tightened until it bordered on pain. She swallowed hard, forcing that reaction down where the rest of it lived. I am, she said softly. Focus on breathing. His eyes closed, but not in surrender, more like trust, thin and fragile. Ward scanned the monitor again. He is holding for now. Let us move. They prepared to wheel the bed out. The residents gathered at the front, grabbing rails and clearing the path. The red light above the doors continued to flash, marking each second as if every moment mattered. Riley stepped back to give them room. Her leg protested as she shifted her weight, the old ache moving up her hip again. Someone brushed past her, muttering about needing to secure the airway before transport. As they rolled Cole toward the hall, his eyes cracked open one more time. His head turned slightly on the pillow, searching the room until he found her again. Riley stood at the edge of Bay 3, her hands still, her breath slow. Cole's lips shaped her name again. Not the one on her badge. The one she had sworn no one here would ever hear. Nightingale. His voice was thin, barely formed, but the effect rippled through her. Hair on her arms lifted. The room seemed to tilt in memory. Riley looked away first. She stepped back into the noise of the ER, pulling on a fresh pair of gloves, her heartbeat no longer matching the rhythm of the monitors around her. The ER settled into a different kind of noise once the last of the ambulances emptied. The sirens faded. The red light above the doors stopped flashing. What remained was the hum of machines, the murmur of families, the low rustle of scrubs and shoe soles. The air felt heavier, filled with the residue of adrenaline and antiseptic. Riley finished charting on the woman with the needle decompression, checked her dressings one more time, then stepped out of Bay 7 and rolled her shoulders. Every muscle in her back complained at once. Her left leg pulsed in a slow, throbbing line from hip to knee. Shift was barely half over. Casey looked up from the desk. Her fingers were still moving over the keyboard, but her eyes lingered on Riley a moment. Rivera is out of surgery, she said quietly. They routed him back down here for post-op. Ward told them to keep him on our floor. Said something about continuity of care. Riley kept her face neutral. Vitals? Holding. They patched a bleed, placed a chest tube, fixed some shrapnel damage. Surgeon was optimistic. Room. Bay 9, he has been asking for you since he could form a sentence. Riley pulled in a breath that did not quite fill her lungs. I have meds to pass in 6 and discharge paperwork in 2, she said. Casey tipped her head toward Ward's office. You can tell that to her. The blinds on Ward's door were half closed. Through the gap, Riley saw the older woman poring over a chart with a pen clenched between her fingers. Lines of fatigue cut deeper across her forehead today. Riley knocked once. Come in, Ward said. Riley stepped inside and let the door click shut behind her. Outside, the ER churned on. In here, the noise thinned to a muffled background. You look tired, Ward said without looking up. So do you, Riley replied. Ward set the pen down and leaned back in her chair. Captain Rivera is awake, she said. He knows where he is. He knows what day it is. He knows your name, both of them from the sound of it. Riley's fingers found the edge of the exam table and wrapped around it. He is disoriented from anesthesia, she said. Pain meds, the blast. Ward's gaze sharpened. He remembers you from Dalak Valley. The name hung between them like static. Riley had never said it out loud in this building. Hearing it come from Ward's mouth pulled a thread she had worked hard to tie off. You knew I had been deployed, Riley said. You did not know the details. I knew enough to recognize combat medicine when I saw you work, Ward said. Most nurses do not move like that in a mass casualty. She paused. I also know what it looks like when someone tries very hard not to talk about it. Riley looked down at her hands. They were scrubbed clean, but faint indentations from gloves still marked the skin at the wrists. He is asking for you, Ward said. By name. I can keep him away for a while. I can tell him you are busy or that you are not allowed to visit as staff, but he will not stop asking. Men like that do not let go once they have their teeth in something. Riley gave a small bitter smile. I noticed. You want out, say it, Ward said. I will run interference. Riley thought of Cole's face on the gurney, the way his eyes had cleared when he saw her, the rough surprise in his voice when he realized she was alive. Avoiding him would buy time. It would not change the fact that he was in this building, that his memory was sharper than she wanted it to be. Refusing to see him would also be a choice. No, Riley said quietly. I will go. Ward studied her for a second, then nodded once. I will be in the next bay, she said. If he starts asking questions you do not want to answer, page me. I can be the bad guy. Riley managed a small nod of thanks and stepped out. Bay 9 was at the far end, near the supply closet that never closed right. The curtain was pulled halfway, leaving a gap just wide enough to see the lower half of the bed. Barefoot hospital sock the end of a sheet. Riley stopped just outside the opening. She slid her thumb along the edge of her badge over the printed name Hart Riley, RN. You still fly, Emma had written. She pushed the curtain aside. Cole lay propped up partly on his side as much as the chest tube and dressing aloud. His skin held a healthier color now under the fluorescent light. An IV line dripped a measured rhythm into the back of his hand. The beeping monitor above him mapped out his heart rate in slow, regular peaks. He turned his head at the sound of the curtain. His eyes were clearer than they had been in Bay 3, but there were still shadows under them. He watched her the way he had watched a horizon full of unknown shapes once upon a time. Nightingale, he said. Riley pulled the curtain fully closed and stepped to the foot of the bed. My badge says Riley, she said. Badges lie, Cole said. His voice had gravel in it. I have seen enough of them to know. He tried for a smile, but it came out crooked, tugged by pain. Riley moved to the side of the bed where she could see his chart and still keep him in her peripheral vision. How is your pain, she asked. Manageable, he said. Then he added liar. On a scale from 1 to 10, she said. 7 with spikes, he admitted. They keep offering me more, but I wanted a clear head when you got here. You are supposed to let the meds work so your body can heal, she said. I have done the tough guy routine, he said. I'm not trying to impress anyone. I just need to remember straight. He shifted slightly, winced, and let his head fall back. I thought you were dead, he said. The words came out flat, like a fact he had been carrying so long it had carved its own groove. Riley stared at the chart, though it contained nothing she did not already know. Blood loss, internal bleed repaired, shrapnel removed, chest tube placed, vitals stabilizing. So did a lot of people, she said. You disappeared, Cole said. Your name dropped off every report. No forwarding information, no contact. I asked everyone who had ever heard your call sign. Nightingale this, Nightingale that. It was like you were a ghost they had invented in the valley. Ghosts do not limp, Riley said. He huffed a laugh that turned into a cough. He pressed a hand against his side until it passed. You saved my life, he said when he could speak again. You remember that, or did they scrub it from your file, too? She remembered. She remembered the way his blood had soaked through her gloves until she could not feel her own fingers. She remembered pressing her hand against his thigh with everything she had, counting his breaths in the dark while tracers burned the sky. It was not just me, she said. You had a team. I had a team, he repeated. 3 of them did not make it out of that valley. The rest of us only did because you refused to get on the bird until every body that could move was on it. His gaze fixed on her scarred leg beneath the blanket of scrub pants. And you left a piece of yourself out there. Riley looked up sharply. Surgical scars do not lie either, he said. You did not have that limp before. Occupational hazard, she said. He watched her in silence for a long moment. In Dalak, he said slowly, you saw something. You went quiet when it happened, not in the field, after, in the debrief, in the hospital. It was like someone had reached inside you and flipped a switch. Riley felt her throat go dry. We were hit from two sides, Cole continued. The timing was too perfect. The weapons they had, the way they moved, that was not a random group of farmers with ancient rifles. I pressed our intel guys after. They brushed me off, said I was rattled, said I wanted to blame someone friendly to avoid admitting the enemy was good. They said the same thing to me, Riley said. So it was not just in my head, Cole said softly. The room seemed to close in. The beep of the monitor grew louder. The air carried the faint smell of antiseptic cream and plastic tubing. I saw crates, Riley said. The words came out quietly, each one scraped on the way up. Wooden, stenciled with manufacturer codes. American, new, no dust yet. They broke open when the first blast hit. Rounds spilled out into the dirt with the labels still on. Cole's jaw tightened. His knuckles whitened against the sheet. And the men shooting at us were using them, he said. She nodded once. I saw a face too, she said. Above the ridgeline, watching, not one of yours. Officer, Cole asked. She hesitated, then answered. Colonel Nathan Reddick. The name landed like a dropped instrument, a sharp clatter only they seemed to hear. Cole stared at her. He was in our command center, Cole said. We briefed in front of him. He signed off on our route. I know, Riley said. I saw him in that room too. Then I saw him on the other side of the valley with men who were not supposed to have our guns. Silence stretched between them, filled with years that had not been discussed. What happened after? Cole asked. His voice had shifted, less gravel, more steel. To you, I woke up 3 days later in Bagram. They told me you had been evaxed. They told me you were recovering in Germany, then stateside. Then your name was gone. They evaxed me to Germany, Riley said. I had surgery. A man from the Department of Defense visited my room before I could stand without collapsing. He did not give a name that stuck. He said there had been confusion in the valley, faulty intel, delayed air support. Tragic but not unusual. Cole's eyes darkened. He asked what I remembered, Riley went on. He wanted details, crate numbers, faces. I told him. What did he say? Cole asked. He said I was mistaken, she said. That trauma plays tricks on memory. That if people got the wrong idea, it could cause unnecessary panic, hurt ongoing operations. She unclenched her hand from the rail and flexed her fingers. A week later, a medical board reviewed my case, she said. They decided my leg would never be reliable in the field again. They stamped me unfit for duty. Honorable discharge, full benefits. They expedited the paperwork. They shoved you out, Cole said. They gave me a pension and a signature line where I acknowledged that aspects of my last deployment were classified, Riley said. Then they suggested I find a quiet life, somewhere far from anyone who might ask questions about Dalak. She drew in a slow breath, then let the last piece fall. They also showed me a photo, she said. My kid sister outside her high school. They knew her route, her schedule, her friends. They said accidents happen when people get nosy. Cole's eyes went cold. They threatened Emma, he said. I became scared. Not in so many words, Riley replied. They talked about the stress of losing loved ones suddenly, how difficult that could make recovery. They hoped I would not have to learn that firsthand. He closed his eyes for a moment. When he opened them again, the softness was gone. What remained was the hard, focused look she remembered from nights in the valley. And so you became Riley Hart, RN Bayview, VA, he said. No more Nightingale, no more questions. Just a limp and a job and a lot of silence. That was the idea, she said. He shifted on the bed, ignoring the tube tugging at his side. They did not count on us ending up in the same room again, he said. Riley glanced toward the curtain, though she knew it was closed. The ER noise seeped through distant but present. No, she said. They did not. The curtain rustled. Riley stepped back a little, her fingers leaving the cold metal rail. Instinct made her check the monitor out of habit, though Cole's vitals were holding steady. Ward's face appeared in the narrow gap. Her eyes flicked from Cole to Riley, then to the space between them. You two are very quiet for people who just survived a mess like that, Ward said. Everything all right in here? Peachy Titch, Cole answered. Best day I have had in weeks. It came out dry, but the effort to sound normal was obvious. Riley cleared her throat. We are fine, doctor. Ward's gaze lingered on Riley for a beat. Her expression was carefully neutral. The corner of her mouth twitched like she wanted to say more, but something out in the hall pulled her attention. A new voice, unfamiliar, floated in through the opening. Low, smooth, practiced. "I am looking for Sergeant Riley Hart." Riley felt it like a drop in temperature. Cole's eyes sharpened. Ward turned her head toward the sound. "This is a restricted area," she said. "Family only, staff, patients." "I am here on official business, the voice replied. "Department of Defense." The words landed heavy. Riley's heart picked up pace again, not the clean thrum of work, but a jumpy flutter. Ward stepped fully into the bay and pulled the curtain nearly closed behind her, leaving only a sliver of hallway visible. She lowered her voice. "That for you?" she asked. Riley did not have to answer. Her face did it for her. Ward's jaw set. "Stay put," she said. "Let me find out who thinks they can stroll into my ER without signing in." She left before Riley could argue. The curtain swayed once, then fell still. Cole watched Riley. The joking edge was gone from his features. "They followed you," he said. "Or you," she replied. "Not with that voice, he said. "Whoever that is did not spend the morning yelling over a training range." Riley listened. Ward's voice in the hall, controlled, firm. "You can leave a card with the front desk." The other voice patient. "Doctor, I respect the need for protocol, but time-sensitive investigations are not always convenient." The words sent her backward through time. Hospital linen, the hiss of oxygen, a stranger in a suit at the foot of her bed while she tried not to sweat through the sheets. He had not given a name she remembered, just credentials. DOD seal on an ID card held in a steady hand. "Same person?" Cole asked quietly. "Maybe," she said. The curtain moved again, not enough for anyone to enter, but enough for a shadow to fall across the floor. Ward reappeared. Her expression had shifted from guarded to something closer to resigned annoyance. "He is not leaving," she said. "He has a badge that looks legitimate and enough clearance codes to make my administrative director sweat. I can stall only so long before someone from upstairs comes down to shake his hand." Riley nodded once. "What does he want?" Cole asked. Ward shot him a look. "I suspect he wants to ask Sergeant Hart why a classified call sign from a buried operation just got spoken out loud in front of half my staff," she said. She turned back to Riley. "You do not have to talk to him alone," Ward said. "I can be in the room, or I can tell him no until he finds someone with more stripes than mine." Riley thought of Emma's face in the photo they had held over her bed 3 years ago. The crisp school uniform, the doodles on her notebook, the way her braid had swung mid-step. "If I say no now, he will find another way to make it, yes," Riley said. Ward's mouth pressed into a thin line. "Then I will keep the door open and my ears working." She stepped aside and let the curtain open a hand's width. The man who filled the gap was not tall in the way movie agents were tall, but he carried himself like height was implied anyway. His suit was dark cut, well enough to blend in anywhere offices existed. His tie was loosened just enough to suggest a long day and real urgency. His eyes were wrong. Not their color, their focus. They swept the room, once cataloging everything, then settled on Riley. "Sergeant Hart," he said, "you look better than the last time I saw you." The air in Riley's lungs turned thin. The wallpaper in that German hospital room flickered through her mind. The way his silhouette had filled the doorway while nurses pretended not to listen. "You have me at a disadvantage," she said. "You remember me? I do not remember you." His mouth curved. Not a friendly expression, just a small arrangement of lips that said he was amused she had chosen to say it like that. "Agent Victor Hale," he said. "Department of Defense, you were recovering from surgery when we spoke. I did not expect to make a second house call." He flashed his badge toward Ward, then tucked it away again. Cole watched from the bed, eyes hooded, taking him in. "I appreciate you keeping it a full reunion," Hale added, glancing at Cole. "Saves me some time." "This is a medical bay," Ward said, "not an interview room." "Dr. Ward," Hale nodded, remembering her name off the badge. "And I am not conducting an interview, I am having a conversation about operational security." He looked back at Riley. "Your call sign came up today, he said, in a place it should never have been used." Riley kept her voice even. "He was my patient. He had just come out of surgery. People say strange things when they are in pain." "It was not pain talking," Cole said. Hale did not look at him yet. 3 years, he said to Riley. "That was the agreement. You step away. You keep quiet. You do not chase ghosts. In return, certain people in your life remain unbothered by unfortunate incidents. I am summarizing, of course." He slid a hand into his jacket, and for a brief second, Riley saw Ward tense, the way a person does right before a code, every muscle ready. Hale brought out a phone. He tapped the screen a few times, then held it up so Riley could see. The image was sharp and bright, taken in good light. Emma, older now, hair shorter, walking across a college quad with a laptop bag slung across her shoulder. The trees in the background were familiar. Pacific Coast University, the art building. Riley's throat closed. She changed her hair, Hale said conversationally. Suits her. She keeps her head down when she walks. That is good. Less eye contact, less risk. Ward's fingers tightened on the chart she was holding. You have no right to involve her, Ward said. Hale spared her a glance. I am not involving anyone, doctor. I am observing. The world is full of cars with faulty brakes and young people with bad reflexes. His gaze returned to Riley. The problem we have, he said, is that one of the few living witnesses to a sensitive incident just got her call sign shouted in front of an audience. That tends to make people curious. Journalists, congressional aides, investigators without the full picture. You mean without your picture, Cole said. Hale finally turned to him. Captain Rivera, he said. I'm glad to see you in one piece. That was not guaranteed when I saw the first reports from Coronado. You were reading range incident reports that fast, Cole said. Busy man. Busy does not begin to cover it, Hale replied. We keep the world from spinning off its axis while you boys play in the dirt. Cole's mouth twitched. I remember you now, Meg, he said. You came through our FAB once, sat in the corner during a debrief, said nothing. Listening is underrated, Hale said. He lifted the phone a little higher in Riley's direction. Here is what needs to happen, he said. Ifayabov said, you stay Riley Hart, ER nurse. You do not become Nightingale again. You do not testify. You do not call old contacts or new reporters. You treat your patients, you go home, you pretend Dalek was just another bad memory. Captain Rivera here does the same. He chalks up his questions to concussion and chaos. And if we do not, Riley said, then Emma Hart's commute gets more dangerous, Hale said. Or Captain Rivera's team starts having very unlucky training accidents. Bridges collapse, boilers leak. Some of us do not see the next sunrise. The room felt smaller. The walls already closed drew in further. Ward stepped closer to the bed, placing herself between Hale and Cole almost without thinking. You are threatening my staff and my patient in my ER, she said. Her voice was soft. That made it worse. I am stating consequences, Hale said. Choices have weight. He pocketed the phone. Tell me you understand, he said to Riley. Riley could feel the tremor trying to start in her hands. She stilled them by curling her fingers into her palms. You made yourself very clear 3 years ago, she said. You are even clearer now. Hale nodded, slightly satisfied. Good, he said. Then we can consider the terms extended. He turned as if to go, and for a second relief flared bitter and shaky. Then Cole laughed. It was not loud, a low, rough sound that made his stitches protest. He winced and laughed anyway. Hale paused, looking back at him. Something funny, Captain, he asked. Just the part where you think you are the only one who knows how to listen, Cole said. He reached up with his free hand and tugged at the edge of the hospital gown near his collarbone. Beneath the tape and sensor leads, a small device sat tucked against his skin, secured by a layer of transparent dressing. A tiny red light blinked there in a steady pattern. Hale's expression did not change, but the air in the room shifted again. Standard operating procedure for SEAL team leaders after a classified training op, Cole said. Continuous recording for debrief. Audio goes straight to a secure server as soon as we hit a signal. He tapped the device lightly with a fingertip. You have been very chatty, he added. Riley's pulse jumped. Ward's eyes widened the smallest fraction. Hale's hands stayed at his sides, but the careful ease in his shoulders disappeared. You are bluffing, he said. Bing, he said. Cole smiled, teeth showing now. You really want to bet on that, he asked. Somewhere beyond the curtain, a new sound cut through the ER noise. Heavy footsteps, several pairs, voices calling out authority, not fear. Federal agents, a woman's voice said in the hall. Everyone stay where you are. Riley felt Ward move to the curtain, pulling it aside in one quick motion. A trio of people in jackets with yellow letters entered the bay. The woman at the front held up a badge. Special Agent Maya Torres, FBI, she said. Her gaze landed squarely on Hale. Victor Hale, you are under investigation for multiple counts of obstruction, intimidation of a federal witness, and participation in an illegal arms trafficking conspiracy. I suggest you keep your hands where I can see them. Hale stood very still. For the first time since he had entered the room, his smile slipped. For a heartbeat, no one moved. Then Hale exhaled a thin, almost laugh. His hands lifted slow and empty. Agent Torres, he said, you are interrupting a sensitive conversation. You already had it, Torres answered. On the record. 2 agents stepped in on either side of him. Plastic cuffs clicked tight around his wrists. One of them patted him down with brisk impersonal motions, then took his phone and slid it into an evidence bag. You have the right to remain silent, Torres began. Hale cut in. We are all on the same team here. She did not stop. Anything you say can and will be used against you in a court of law. Her voice was steady, practiced. Riley watched Hale's jaw tighten as the words rolled over him, legal phrases wrapping around the polished calm he had worn into the room. You are making a mistake, he said. That is what trials are for, Torres replied. Around the bed, the ER had gone still in a way Riley had never seen. Nurses hovered near curtains. A respiratory therapist peered in from the hallway. Even Logan had drifted close, drawn by the gravitational pull of authority and scandal. Ward stepped forward, putting herself between Hale and the rest of the crowded unit. This is still my ER, she said. You want to drag a man out in cuffs, you do it without scaring my patients. Torres inclined her head. We will work fast, doctor. My people will coordinate with your security. She looked back at Hale. Victor Hale, she said. You are also being investigated for your role in the diversion of American-manufactured weapons to hostile actors. If there is anything you want to say in your own defense, I suggest you save it for your lawyer. Hale's eyes went to Riley then, not pleading, measuring. You think this fixes anything? He said quietly. One recording, one arrest. You have no idea how deep this goes. Then you should have picked better friends, Cole said from the bed. Torres nodded to her agents. They moved Hale toward the curtain. As he passed Riley, he paused just long enough to meet her gaze. There was no apology there. Only irritation, a faint edge of something like admiration and a cold promise. We could have kept it clean for you, Kikshintawam, he said. You will not like the messy version. Walk, one of the agents said, guiding him forward. They took him out into the corridor. The curtain fell closed behind them, muffling the rise of voices in the hall. Someone gasped. Someone else whispered FBI, like they were saying the name of a storm. Ward blew out a breath that seemed to come from somewhere deep. Well, she said, that will make for an interesting staff meeting. Cole let his head fall back into the pillow. The brief flare of adrenaline left his face paler than before. The monitor beeped a little faster, but still within the lines of acceptable. Riley realized she had been standing perfectly still. Her fingers were numb. She flexed them slowly, feeling blood return in a prickling rush. You all right? Ward asked. I do not know, Riley said. Are we? Depends who you ask, Ward said. From where I stand, we just watched federal agents walk a threat out of my hospital. I'm going to call that a win until someone makes me downgrade it. The curtain opened again more carefully this time. Torres stepped back inside, leaving her agents in the hall to deal with the ripple of curiosity. Up close, she looked younger than Riley had first thought. Early 40s, maybe hair pulled back in a tight bun that had survived a long day. There were faint lines at the corners of her mouth, the kind that come from clenching teeth during other people's bad choices. Sergeant Hart, she said. Captain Rivera? She nodded to each of them. Dr. Ward, thank you for not throwing us out, she added. I am still considering it, Ward said, but there was a thread of dry humor in it. Torres allowed herself a hint of a smile. I will keep this short, she said. I know you still have a pile of people who need you more than I do. She gestured toward Cole's chest where the small recorder blinked on. I am going to need that device, Rishayan said, and a copy of whatever it has captured since you woke up. Chain of custody is Navy Intel Cole said. You will have to go through them. We already are, she said. They brought us in 6 months ago when some of your colleagues started asking why American rifles kept turning up in the wrong photos. Her gaze flicked to Riley. Today gives us something we have not had yet, she said. A direct threat recorded involving a witness we did not even know we still had. Riley swallowed. The word witness lodged in her chest like a new piece of shrapnel. You knew about Dalek, Riley said, about what happened. We knew about a spike in casualties that did not fit the pattern, Torres said. We knew about missing inventory and fudged manifests. We did not know who saw what on the ground. Her expression softened a fraction. People in your position tend to vanish from the paperwork, she said. Medical discharges, reassigned, a note that says status classified, then nothing. Riley did not answer. You have both given us more in 10 minutes than some investigations give us in a year, Torres said. That also means your names are going to start appearing on lists you would rather not be on. Ward stepped in. You can discuss lists and investigations out of my baby, she said. Right now, my priority is to keep my patient from ripping his stitches and my nurse from passing out on her feet. I'm not going to pass out, Riley said. Good, Ward replied. Then you can sit down before you fall down. A small stool appeared at Riley's knee. She did not remember pulling it closer. She lowered herself onto it before argument could form. Torres watched the exchange with something like respect. I will coordinate through you, she said to Ward. We will need formal statements when you are off shift and when the captain is cleared by his surgeon. One thing at a time, Ward said. Torres nodded once more to Cole and Riley, then stepped out, letting the curtain drop behind her. The hall picked up its usual rhythm slowly, as if someone had turned down a volume knob and was cautiously edging it back up. A tech rolled an EKG machine past. A dietary aide with a cart full of lukewarm meals navigated around an agent in a windbreaker. Logan appeared in the gap of the curtain, eyes bright. "So," he said, "you want to explain how my ER turned into the set of a crime show, Hart? Or do I have to watch the evening news?" Ward turned her head. The look she gave him could have chilled coffee. "Your ER, Evening, she repeated. He lifted his hands palm out. "Our ER. Your ER has patients in 4 and 6 still waiting on their reassessments," Ward said. "Unless you want me to believe that you abandoned them during a mass casualty and a federal arrest, I suggest you move." Logan flushed. He opened his mouth, closed it, then walked away faster than he had come. Cole watched him go, amused in spite of the pain. "I like her," he said. "You should," Ward replied. "She's the only reason you're not lying 3 beds over from a chart with fewer interventions." She picked up his chart now and flipped it open. "You are stable for the moment," she said. "You will stay that way if you let the nurses do their job and stop trying to volunteer for more drama." "Yes, doctor," Cole said. "Same goes for you," she told Riley. "Check on your other patients, drink some water, and pretend the last 15 minutes have not happened until I tell you otherwise." Riley stood. The stool scraped softly. Her legs felt heavier but more solid, like the ground had decided to hold her again. As she reached for the curtain, Ward touched her elbow. "You did good," Ward said quietly. "In there and out there." Riley nodded, though the words slid off the surface without sinking in. She stepped back into the main corridor. The ER looked almost normal. A visitor argued with a registrar about parking validation. A janitor mopped up a trail of something from Bay 2. The television in the waiting area had been muted, but captions were rolling under footage of flashing lights at some unrelated scene across town. Her pocket buzzed. Riley frowned, pulling out her phone. It had stayed silent since the start of the mass casualty. She had assumed Emma was in class, had buried in some project oblivious to sirens and helicopters. The notification banner showed an unknown number. She opened it. A photo filled the screen. Emma again from a different angle. Indoors this time. A long table book spread out overhead, lights reflecting off polished wood. The old library at Pacific Coast University. Riley recognized the arched windows in the blurred background. Emma's head was bent over a notebook, hair falling forward as she wrote. A pen in her hand, her face half hidden, looked peaceful. There was a crimson dot on her chest, tiny, perfectly round, right over her heart. Text sat under the image. "Victor was always careless. We are not. Tell Nightingale to watch her little bird." Riley's fingers tightened around the phone until her knuckles hurt. The sounds of the ER faded. The hum of lights, the murmur of voices. All of it dropped behind the roar in her ears. She read the message again, as if the words would change if she stared hard enough. They did not. The words did not change. Riley's thumb hovered over the screen, useless. Her hand had gone cold. The phone felt heavier, as if someone had slipped a weight into the sleek case. Her first thought was wrong, and she knew it. It was not, "This cannot be real." It was, "Of course they had a backup." Her vision narrowed around the photo. Emma's familiar slouch, the messy stack of books, the little crease between her eyebrows that appeared when she concentrated, the red dot tiny and obscene. Riley. Ward's voice came from somewhere to her left. It sounded distant, like she was hearing it through water. "Hart." This time it cut through. Riley lifted her head. Ward was at the station, one hand on a chart, the other already reaching toward Riley. Her gaze dropped to the phone. Her eyes sharpened. "What is that?" Ward asked. Riley could not make herself explain. She simply turned the screen and held it out. Ward took in the image in one quick, precise scan. Her jaw clenched. "Where?" she asked. "Pacific Coast," Riley said. Her tongue felt thick. "The old library." "You are sure?" "Those windows," Riley said. "She sends me pictures when she studies there. Says the light is good for sketching." Ward did not waste a breath on outrage. She reached for the nearest phone on the desk, punched in a number with the speed of habit, and turned slightly away. "This is Dr. Ward at Bayview," she said. "I need Special Agent Torres back in the ER immediately. Tell her it is about the weapons case." Riley's heart was beating in a tight, painful rhythm. The hallway seemed to tilt. She grabbed the edge of the desk to steady herself. Casey stepped forward, hand half out. "Do we need security?" she asked. "We need the FBI," Ward said. "And we need local law enforcement. But first we keep our nurse from running all the way to Pacific Coast on foot." Riley pulled in a breath. It tasted like stale coffee and plastic. She forced it down. "I am going," she said. I'm dead." "You are not going anywhere alone," Ward replied. The curtain at Bay 9 snapped aside. Cole had pulled himself up higher, ignoring his IV lines, one hand pressed to his side. "What happened?" he demanded. "I heard Torres's name." Riley looked at him. The effort it took to form words almost hurt. "They sent a picture of Emma," she said. "Library. Someone has a laser on her." Cole's face changed. The color drained out of it, leaving his eyes standing out dark and sharp. "Let me see," he said. Riley walked the few steps to the curtain. The floor felt uneven. She showed him the screen. He studied the image for one hard second, then another. The red dot. The timestamp. The blurred shelves behind Emma. "How old is this?" he asked. 10 minutes maybe, Riley said. "Maybe less. I did not see it come in." He did the math faster than she could. He always had. "She is still there," he said, "or they want us to believe it." Torres appeared at the end of the hall, moving with purpose, 2 agents in her wake. Ward lifted a hand and pointed toward Riley without speaking. Torres closed the distance in quick strides. "What did he send now?" she asked. "It was not Hale Kiki Inuahiho," Riley said. "He is cuffed. This is someone else." She held up the phone again. Torres's eyes flicked to it, absorbed the image, then snapped to Riley's face. "Emma Hart," Torres said. "Your sister." "Yes." Torres hissed in air through her teeth, a sound of pure frustration. "We were already drafting a protection detail," she said. "We are behind." "Then catch up," Riley said. The sharpness in her own voice surprised her. It did not seem to surprise Torres. "Where exactly is this room?" Torres asked. "Old part of the library at Pacific Coast," Riley said. "Basement level. She prefers the tables near the back wall. Quieter." Torres turned to one of her agents. "Get me campus police on the line. Tell them to start an immediate lockdown of the library and evacuate everyone they can without turning it into a stampede." She looked back at Riley. "I want you out of this hallway, Craig," Torres said. "You are a witness. You have already been threatened. You are not leaving the building without an escort." Riley shook her head. "You are not understanding," she said. "They are using her to get to me. They said so." She tapped the message beneath the photo. "Tell Nightingale to watch her little bird." Torres went still. "So, they know your call sign," she said. "And they know Hale is down. They move fast." "They were always going to move fast," Cole said from the bed. "You cut off one piece, the others scramble." Torres pulled out her phone and stepped a half pace away while still facing them. "This is Torres," she said when someone picked up. "We have an active threat against a civilian at Pacific Coast University connected to the Hale operation. I need SWAT unmarked en route to the old library building. I also need eyes on Sergeant Hart's sister Emma. Arts major, brown hair, 5'5". Start with the lower levels. She likes quiet corners." Her tone left no room for debate. She listened, lips pressed together, then spoke again. "If campus security has cameras in the stacks, I want access yesterday," she said. "And someone get me a map of that building that is not just the glossy brochure version." She hung up and looked at Riley. "How far is Pacific Coast from here in traffic?" Torres asked. 25 minutes with sirens," Ward answered before Riley could. "It is across the bridge, assuming the freeway does not decide to become a parking lot." "We do not have 25 minutes, Riley said. Torres knew that. It showed in the tightness of her jaw. "I will send agents ahead," she said. "You stay here." "No." It came out too fast raw. Torres' eyes hardened. "This is not negotiable," Torres said. "You are a key witness in a federal investigation. If you walk onto that campus, you become a priority target, and every tactical team there has to worry about pulling you out instead of focusing on the shooter." Riley stepped closer, phone still in hand. "They already have a target," she said. "She is my sister. They are using her to make sure I do exactly what you are asking me not to do. Sit still." Torres opened her mouth, closed it, and looked briefly at Ward as if hoping for backup. Ward folded her arms. "As acting medical authority on duty and a commissioned officer in the reserve, I can relieve Sergeant Hart of duty," Ward said. "I cannot stop her from signing out as a private citizen and walking out my doors." She turned to Riley. "I will not let you go alone," Ward said. "But I am not going to chain you to a bed either." Cole swung his legs over the side of his bed. The motion was a mistake. His face went gray and his hand flew to his chest where the tube tugged. He stayed upright anyway, feet flat on the floor. "You are not going anywhere," Ward said sharply, crossing to his side. "I am, Chikzuman," he said. "She needs someone who knows how these people think, how they move. You do not put a medic into a hot zone without someone who can shoot back." "You are barely out of surgery," Ward said. "You can barely sit." "I can shoot sitting," Cole said. "Prop me against a pillar. I have done worse." Torres looked torn between objecting and calculating. "Navy intel already has a detail en route to Pacific Coast," she said. "You leave this bed, you risk reopening half of what we just fixed. You understand that. I also understand that if they wanted Emma dead already, she would be," he said. "They are waiting. Waiting takes structure. Structure can be disrupted. You want your Operation Agent Torres, you need someone on the ground they care about, someone they think they can control. He nodded toward Riley. They want her, he said. They are not going to blow the place while she's still on the freeway. Riley did not like that logic. She understood it too well. Torres rubbed the bridge of her nose once hard. I hate that he is right, she said. Ward took a breath. Torres, how quickly can you get a police escort from here to Pacific Coast? She asked. If I walk downstairs and scream, Torres said 5 minutes. Do it, Ward said. I will sign Hart out under emergency circumstances and go with her, as medical support and as someone with a uniform number your superiors can yell at if they do not like it. You do not have to go, Riley said. I do, Ward replied. You are not my only responsibility, but you are one of them. And Emma is about to become all of ours, whether she wants to or not. Torres looked between them, then at Cole. You are not cleared to leave, she said. Since when has that ever stopped me? He replied. Riley stepped to his side and put a hand on his shoulder. You will slow us down, she said. You know that. I know I owe you a life, he said quietly. Let me be there when you try to collect. The monitor beside him showed his heart rate climbing. Ward swore softly under her breath. If he signs an against medical advice form, he will leave anyway, she said to Torres. At least if he goes with us, I can keep him from bleeding out in the parking lot. Torres blew out a slow breath. Fine, she said. You go as a unit. Hart Ward Rivera. You do not engage unless there is no choice. You wait for SWAT to coordinate. You keep your phones on and your heads down. If I find out any of you tried to play hero without backup, I will bury you in paperwork for the rest of your natural lives. She was already moving, issuing the next set of instructions over her shoulder. I want a squad car out front in 4. Lights no siren until they hit the bridge. I want tactical updated every 30 seconds with your position. And somebody get the campus on the horn again. If one security guard walks into that library with a flashlight and a stern voice, I will have them sweeping parking lots for a year. Riley did not wait to hear the response. She helped Ward ease Cole back enough to entangle his lines, then reached for the IV taped to his hand. You pull that out without me, you will tear the vein, she told him. You are the boss, he said. Do not tell Pierce that, she replied. His laugh came out as a short breath. Ward worked quickly, disconnecting what could be disconnected, capping lines, taping dressings. Cole gritted his teeth and said nothing. Within minutes, he was in a wheelchair hospital gown, half hidden under a set of sweats someone had scavenged from a donation bin. A blanket covered his lap, hiding the drain line at his side. You look terrible, Riley said. Perfect, he replied. Ward grabbed a trauma bag, checking its contents with quick, practiced eyes. Oxygen tourniquets, bandages, airway equipment, the tools she could carry. You have 2 minutes, she told Riley. Go grab your shoes and your phone charger if you want it. We may be there a while. Riley did not waste time arguing. She moved through the familiar maze of the ER on automatic, swapping her soft clogs for sturdier shoes, stuffing a charger and her ID into her pockets. She paused by the corkboard eyes catching on Emma's bird sketch. You still fly. She took it down and folded it once, tucking it back into the same pocket as before, placing it behind her phone against her leg. When she came back, Torres was already by the double doors, talking rapidly into her phone. 2 uniformed officers waited just outside their patrol car, idling at the curb lights ready. Ward stood behind Cole's chair, one hand on the handle, the trauma bag slung over her shoulder. Riley took her place beside them. The door slid open. Heat rushed in from the parking lot, thick with exhaust and the faint tang of the ocean beyond the city. Riley stepped through first. The glass doors closed behind them with a soft hiss. The patrol car smelled like vinyl coffee and old fast food. Riley slid into the back seat beside Cole's wheelchair, shoulders brushing the cool glass of the window. Ward folded herself into the front passenger seat, trauma bag between her feet. The officer behind the wheel glanced at them in the rearview mirror. His name tag read J. Miller. His jaw muscle twitched as if this was not his first strange shift, but maybe the strangest today. You folks buckled, he asked. Just drive, Torres said from the open driver's side door. She leaned in one hand on the roof phone still at her ear. The radio on her shoulder crackled quietly. Miller flicked on the light bar. Red and blue strobed across the hospital facade, painting the glass in pulsing color. He pulled away from the curb, easing out, then punching the accelerator once they cleared the last of the slower cars. No siren at first, just the rush of wind and the rise of engine noise. Riley watched Bayview recede in the side mirror. The emergency entrance door slid shut behind them, closing with that soft hospital hiss that never sounded like the finality it sometimes was. Torres jogged toward an unmarked sedan. Agents climbed into CVs behind her. A small convoy formed almost without words. Miller glanced at his radio. Dispatch Unit 24 en route to Pacific Coast University with FBI escort Yishe, he said. Requesting traffic priority on Harbor and Bridge. The dispatcher's voice crackled back disembodied. You are cleared. CHP notified. They hit the main road. Miller flipped the siren on for the merge. The sound knifed through the car, high and spiraling. Other vehicles parted slowly, then with more urgency as the lights reached them. Riley pressed her phone so hard into her thigh she could feel the outline through her scrubs. The folded paper of Emma's bird sketch sat between device and skin, crinkling with each breath. Cole sat stiffly, one hand braced on the seat, the other on his side. His face had the drawn look of someone writing out pain in silence. You still with me? Riley asked quietly. Define with, he said. His teeth flashed for a second. I am conscious. That counts for something. Ward twisted slightly in her seat to look back at them. We are 10 minutes out if traffic keeps cooperating, she said. Torres has tactical units staging on the far side of campus. Staging, Riley repeated. The word tasted wrong. She will not send them in blind, Ward said. They need layouts, heat signatures if they can get them lines of fire. In 10 minutes they could have her out and gone, Riley said. Cole shifted, hissing softly as something pulled where it should not. People like Reddick do not rush when they think they are in control, he said. They choreograph. They want every angle. Riley stared at the blur of buildings sliding past. Stores, apartment blocks, a glimpse of the bay gray under the afternoon light. The bridge loomed ahead, concrete rising. Reddick, Ward said. You are sure it is him? I'm sure he was in the valley, Riley replied. I'm sure his name is on every ops plan we saw. I'm sure Hale did not work alone. He is above Hale, Cole said. Hale was the messenger. Reddick is the man who never sits with his back to the door. How many like him? Ward asked. Oyacht. Enough for Torres to lose sleep, Cole said. They took the on-ramp to the bridge. The city fell away beneath them in a patchwork of roofs and roads. The ocean stretched out to the right, dotted with ships and the faint silhouettes of naval vessels. The siren bounced off the concrete barriers, coming back at them from both sides. The light bar paint strokes of red and blue along the barrier tops as they flew by. Riley stared ahead, fingers drumming once against her knee. She always turns her phone off when she studies, Riley said. Says she cannot focus if it buzzes. That will work in her favor, Cole said. They do not want her texting anyone. It means she has no idea, Riley said. Ward's voice softened. Then she is not panicking. Panic gets people shot. They cleared the bridge and wove through surface streets. Pacific Coast campus rose up ahead, a mix of modern glass and older brick spread across gentle hills. Tall eucalyptus trees lined the central quad, their leaves shivering in the breeze. Miller cut the siren as they turned onto campus property. The light bar stayed on, but the sudden quiet inside the car made Riley's ears ring. Students on bikes slowed and stared. A group sitting on the grass looked up from their laptops. A campus security cart sat parked near a fountain, two officers inside already talking animatedly into radios. As they approached the older part of campus, the building shifted in style. Red brick narrow windows, stone steps worn smooth. The old library sat slightly apart from the newer structures, its stone facade shaded by oak trees. A set of wide stairs led up to heavy wooden doors. Police tape already fluttered at the bottom of the stairs, anchored to temporary posts. A few campus officers stood in a loose cluster radios, clipped to their shoulders, faces stiff. Miller pulled up short of the tape. Torres's sedan slid in behind them. She climbed out before it had fully stopped, already talking into her phone, eyes on the library. Riley opened her door. Heat pressed in thick and slightly dusty. The air smelled of cut grass and the faint chemical tang of nearby construction. Ward came around to the back, lowering the wheelchair ramp. Between them they eased Cole out of the car. He gripped the armrest's knuckles, pale, jaw clenched. When they reached the tape, a campus officer stepped forward, hand out. You cannot go up there, Kissy said. We have an active situation. They do, Torres said, striding up, and they are part of it. She pointed at Riley. This is the target's sister, she said. She is coming with us. She pointed at Ward. This is Dr. Ward, medical support. She is coming. Then at Cole. And this is Captain Rivera. He is coming even if I tell him not to, so we are pretending it is my idea. The campus officer frowned, then nodded. SWAT is setting up on the south side, he said. We have eyes on all main exits. Fire alarm has been pulled. Building is mostly evacuated. Mostly, Riley repeated. We swept the main floors, he said. Basement is tricky, old layout. Some of the doors are locked from the inside, and the maps do not match what is actually down there. You have seen Emma, Riley asked. The officer shook his head. No visual, no response on loudspeaker. A radio crackled at Torres's waist. A voice came through, distorted but clear. Torres, this is command. We have thermal signatures in the basement stacks. One standing, one seated, maybe two. Hard to tell with the pipes. No movement among the evacuees topside. Tactical is in position but not breaching until we understand the gas situation. Gas, Ward said sharply. The boiler system, Riley said. The news clip in the waiting room flashed in her mind. Rusted pipes, warning signs. Torres pressed the radio closer to her mouth. Command, clarify that gas situation, she said. Old boiler system under the library still has live lines. The reply came. Maintenance flagged it months ago, replacement scheduled for next semester. We are seeing possible heat anomalies near the pipe runs. Could be nothing. Could be something rigged. Heard, Torres said. Hold on, active breach. We are going inside from the service entrance. We need eyes on the ground. Send schematics and pipe routes to my phone. She clipped the radio back and looked at Riley. You still know your way around that basement, she asked. Emma texted me photos when they first opened it up for student use, Riley said. There is a service corridor on the south side, old delivery entrance. Maintenance uses it. That gives us an entry away from the main doors, Torres said. Good. She pointed toward the side of the building. Service entrance is around that corner, she told Miller. You and 2 of your officers come with us. Everyone else waits for my call. You go in without armor, Miller asked. We make it a small footprint, Torres said. Smaller target, less noise. We are not there to clear rooms. We are there to see and to buy time. Riley watched the main library doors. They were propped open now, firefighters and campus staff guiding students out in small groups. Some looked confused, clutching backpacks and phones. Others had that sick edge in their eyes that said they sensed this was not a drill. Somewhere under their feet, Emma sat at a table, a red dot on her chest. Riley did not look at the phone again. She did not need to. They moved around the side of the building. The grass gave way to packed dirt and cracked asphalt. A narrow driveway ended at a metal door, set into the lower level, half hidden by shrubs. A sign read Deliveries in faded paint. Another sign newer was bolted to the brick warning gas line, no open flames. Ward's gaze lingered on that. Charming, she said. Torres tried the handle of the metal door. It refused to budge. Locked from inside, she said. Miller stepped up, eyeing the hinges. Want it quiet or fast? Yeah, he asked. Quiet as a memory, Cole said. We have police cars out front and SWAT in the trees. Fast then, Torres said. Miller took 2 steps back, raised one boot, and kicked just to the side of the handle. Metal groaned. On the second kick, the frame gave and the door slumped inward. A breath of cool stale air came out carrying the scent of dust paper and something faintly chemical. They went in. The corridor beyond was low and narrow, lit by a line of bare bulbs in wire cages. The concrete walls sweated in thin streaks. Pipes ran along the ceiling thick and rust, flecked some wrapped in aging insulation. Ward pushed Cole's chair. The wheels bumped over uneven flooring. How is the pain? Ward asked him under her breath. Like a warm knife, he said. It will do. Riley moved ahead of them, eyes adjusting to the dim. The weight of the building settled around her shoulders. Above somewhere, quiet reading rooms and polished wood. Down here, the skeleton. Torres walked at Riley's side, pistol-drawn grip, professional barrel angled down. At the end of the corridor, it opened into a larger space, half storage, half mechanical. Old shelving units lined one wall, stacked with boxes and archival boxes. The opposite wall was dominated by a hulking boiler, now cold, its gauges dark. Beyond that, a short flight of concrete steps led up to a door with a wired glass window. A handwritten sign taped to it read, Stacks B1. Torres paused at the bottom of the steps. We stop here, she said. Miller, you hold this line. No one in or out, unless it is us. Hart, you go in first. He wants you. Give him you. Not all of you. Just enough. Riley's stomach tightened. You make it sound easy, she said. It is not, Torres said, which is why we are going to be 5 meters behind you with guns. Ward checked her watch. Every minute we stand here is 1 more minute the gas can build up if he has monkeys with a wrench, she said. Torres nodded. Dr. Ward, stay with Miller and Rivera for now, she said. You get pulled into the main room too early, you become leverage. Ward did not argue. She put her hand on Cole's shoulder instead. You come back breathing, she told Riley. Both of you. Riley took the steps up one at a time. Her leg complained, but the stiffness had been burned away by adrenaline. She reached for the handle on the door to Stacks B1. It turned easily. Inside, the air was cooler. The ceiling was higher. Rows of shelves rose up like narrow canyons packed with old journals, bound theses, and boxes labeled with dates. The fluorescent light above flickered once, then steadied. Riley stepped in. Her footfalls were quiet on the worn linoleum. She moved past one row, then another, her eyes scanning the aisles. Riley. The voice came from deeper in the room, not loud but clear, measured. She followed it. The shelves parted into an open area at the far end. A study table sat there, the kind with deep scratches and carved initials from decades of restless students. The arched windows at the back showed nothing but dirt. They were half below ground here. Light seeped in around the edges. Emma sat in a chair in front of the table, hands taped to the armrests, ankles bound to the legs. A strip of duct tape covered her mouth, pressed tight against skin gone pale. Her eyes were too wide. Riley's heart stuttered. Emma. She took a step forward. A figure moved from behind one of the shelves, slipping into the open. The barrel of a pistol rested lightly against Emma's temple. "Stop," the man said. Riley stopped. Colonel Nathan Reddick looked much as he had the last time she had seen him in person. His hair had more gray at the temples now. His face was leaner. He wore civilian clothes, a charcoal suit without a tie, the top button of his shirt open. The posture had not changed. The way he stood as if every room might be a briefing, and he always held the best information. "Nightingale," he said softly, "you clean up well." The sound of that name from his mouth made something cold crawl up Riley's spine. "You are not supposed to be here," she said. "Oh, I am exactly where I am supposed to be," he replied. His tone was almost conversational. "I have been waiting for this little reunion longer than you might believe." Emma made a sound behind the tape. Her shoulders trembled. Riley forced herself not to move. "You are scaring her," Riley said. "That hurts my feelings," Reddick said. "I did not come all this way to upset anyone. I came to tidy up some very old business." He nodded toward a chair opposite Emma. "Have a seat," he said. "Let us keep this civil." "No," Riley said. "You want me? I am right here. You do not need her." He tilted his head. "I do not need her," he agreed. "I want her. There is a difference. You are predictable where she is concerned. Predictability is a luxury in my line of work." He lowered the gun an inch, then raised his other hand. It held a small device, black plastic, a button recessed under his thumb. A wire ran from it, disappearing into his sleeve. "Before you do anything very heroic," he said, "you should know that the plumbing in this old place is more interesting than it looks." Riley's gaze flicked around the room. Pipes ran along the ceiling here, too smaller than in the corridor, but connected. "You are bluffing," she said. He gave a small, toothless smile. "I had maintenance records before I had your sister's class schedule," he said. "The boiler beneath us may have retired, but the gas lines feeding it are very much alive. I have spent a busy morning encouraging them to share their contents with the air down here." Her fingers went cold again. "You press that we all die," she said. He shrugged slightly. "Yes," he said, "but that would be a waste of good leverage. Think of this as a dead man's switch. Literally, if you like. I keep my thumb right here and we all get to have this conversation in peace. Someone shoots me, I drop it, and the whole lower level turns into a cautionary tale about aging infrastructure." Emma squeezed her eyes shut for a moment. When she opened them again, they glistened, but did not spill. "You wired explosives," Riley said. "I encouraged existing vulnerabilities, he said. "Those pipes have been begging for an excuse. I do what I can to help." He nodded toward her again. "You are very popular today," he said. "First Hale forgets how to keep his mouth shut. Now Torres sends teams creeping around my library. Your fault, really. You were supposed to stay quiet and let the world keep spinning." Riley kept her voice even with effort. "Let her go," she said. "You can walk out of here with me instead." "Walk out?" he repeated, amused. "With SWAT in the trees and federal agents on the grass. You still think small Nightingale. This is not a field evacuation. This is theater." He shifted slightly, the gun steady at Emma's head, the little device steady under his thumb. "You come in, you sit down, we talk," he said. "Maybe I walk away. Maybe I do not. But your sister does not die whimpering in a basement because some 20-year-old with a badge panicked upstairs. That is the best concession you are going to get." Riley's leg throbbed in time with her heart. The smell of old paper and dust wrapped around her. Under it, faint, was the chemical hint of gas. Or maybe she imagined it. She took one step forward, then another. She did not sit. Not yet. Reddick watched every inch of Riley's approach, eyes calm, gun, never straying from Emma's temple. The small device in his left hand sat snug in his gripped thumb, resting over the recessed button. "Good," he said. "You remember how to follow instructions." Riley stopped 2 steps from the chair he had indicated, close enough to see the tiny tremor in Emma's fingers where they pressed against the tape, close enough to see the way the adhesive had reddened the skin around her mouth. Emma's eyes met hers. Frantic, yes, but not empty. There was something working behind them, measuring. Riley wanted to look only at her, but she forced her focus wider. Reddick's stance, his angle, the lines of the ceiling pipes above, the narrow opening between shelves where she knew without looking that Torres and the others would be ghosting in quiet and armed. "You like theater," Riley said. Reddick smiled slightly. "Everyone has a hobby." "You could have stayed invisible," she said. "Let Hale take the fall." "He was always going to take a fall," Reddick said. "He just did it earlier than scheduled. Sloppy to talk where he could be heard. Sloppier to underestimate you twice. His gaze skimmed her leg. Last time I gave you more credit, he added. You were faster then. The ache in her thigh seemed to sharpen under his attention. You picked the wrong day to underestimate me too, Riley said. Did I? He asked. I knew you would come. Hale knew it too, not that he will have much use for that insight. This is the part where you and I trade lines about ethics while the timer runs down. You wired a library full of gas to blow because we did our jobs, Riley said. I wired a decommissioned system under a building that should have been upgraded years ago, Reddick said. If the city had better priorities, this would be much harder. I work with what I am given. Emma made a small sound again. Her shoulders shook once. Riley kept her hands visible at her sides. You wanted to tidy up, she said. You said that, so here's your chance. You walk out of here with me, alive. You let her go. You let them shut this down without anyone having to scrape students off the walls. Walk out into what exactly, Fikai? School, he asked. A jury that has never seen a deployment map. A public that thinks guns only exist in movies. Politicians who will spend more time on their hair than on understanding the logistics of power. No, Nightingale. I do not walk out of this. Not in any way you would recognize. I step sideways. Into what? She said. A martyr story you tell yourself. He tilted his head, considering. I do not have time to explain this to you in a way that would satisfy either of us, he said. You saw one valley, one incident. You built a moral universe around it. The world is bigger than Dalek. 3 of his men died because you decided to run guns through their AO, Riley said. Reddick's jaw tightened a fraction. And hundreds more operations continued because we had leverage, so he said. Because we knew who was hungry enough to take our help and who was foolish enough to get in our way. You are calling it leverage, she said. I call it murder. Words, he said. I deal in outcomes. He shifted slightly, the gun steady, the device steady. You know who else deals in outcomes, he asked. The people who signed that discharge. The ones who signed your pension. They chose a quiet life for you. You chose to stand up in my ER and let a half-conscious SEAL shout your ghost name. You sent men with American rifles to kill other Americans, Riley said. I am not the one who broke anything. We will let a court sorted that out, a voice said behind her. Riley did not turn. She did not need to. Tora's tone was unmistakable, calm, thin with anger. Reddick's eyes flicked past Riley's shoulder, then back. Agent Torres, he said. I wondered when your shoes would squeak their way down here. You are outnumbered, Torres said. You have one gun, one hand on a trigger you cannot afford to release. We have teams in the stairwells and on the lawn. You are not leaving this campus free. Free is such a vague word, Reddick said. You must be fun at briefings. Riley could hear the faint hiss of radio chatter at Torres's shoulder. Somewhere behind the shelves, a boot scuffed. Someone shifted weight. Reddick heard it too. His eyes did not move, but his fingers flexed around the device. Careful, he said. The pipes are listening. Torres changed tack. Nathan Reddick, she said. You are under investigation for arms trafficking conspiracy, and more charges than I can list without a notepad. You have a chance to keep this from becoming a massacre. You want me to hand you names, he said. People who have never smelled cordite in their lives. Generals, senators, men who think war is something that happens on television. I want you to release the girl and drop the weapon, Torres said. You do that, I can at least put cooperated under duress in my report. You do not, and the gas and the bodies are on you alone. They are on me anyway, Reddick said. That is what command is, ownership. Emma's eyes had been flicking between them, following the volley without understanding all the words. Now they landed on Riley again, locking there. Riley saw something shift in her, not panic, not surrender. Focus. Emma exhaled once long and shaky, her fingers curled around the tape, binding them, testing. Her shoulders dropped half an inch as if she were settling into a decision. Riley felt the moment, but she could not signal. Anything she did with her face, Reddick could see. She could, however, talk. You have already lost, Riley said to Reddick. Hale rolled over the second you left the building. You know that. You knew the second you heard Torres's voice downstairs. You are not protecting a network. You are covering your exit. Exit, he repeated. Do you see a door here that does not lead through a wall of guns? You could still live through this, Riley said. You could still see a courtroom. I have seen enough rooms, Reddick said. Emma moved. It was not dramatic. No sudden jerk that would draw a reflexive shot. She shifted her weight, a subtle twist at first, then a longer lean. The chair scraped against the floor in a small grating sound as 2 legs lifted. Reddick's head snapped toward her gun, dipping a fraction as he compensated. His thumb tightened reflexively on the device, but he did not release it. Half a second, that was all it was. Behind Riley, metal rang against something solid. A shot cracked through the room. The sound was huge in the enclosed space, bouncing off shelves and pipes. Reddick jerked. The gun flew from his hand, spinning once in the air before clattering across the floor. His left shoulder exploded in red where the bullet had hit. The device in his other hand stayed trapped in his grip, fingers clamping tighter from the shock. Emma's chair crashed onto its side. Her head hit the edge of the table with a dull thud. She went still, eyes squeezed shut. Riley moved before the gun finished skittering. Training did not ask permission. It pulled her forward. She hit her knees beside Reddick, one hand clamping over his bleeding shoulder, the other reaching instinctively for his left wrist. "Do not drop it," she snapped. "You let go, we all cook." Reddick sucked in a sharp breath through his teeth. Pain ripped through his features, stripping away the calm. "You are giving me orders now," he gasped. "Shut up," Riley said. "Stay awake." Boots thundered in the aisles behind her. Torres shouted something about weapons and lines of sight. A second later, hands who were not Riley's grabbed the fallen pistol and kicked it farther out of reach. Riley kept her pressure steady. Warm blood seeped through her fingers, slick and thick, smelling of iron and salt. "Talk to me," she said to Reddick. "You black out, your hand relaxes, we all die." His eyes burned up at her, fever bright. "You think I care?" he said. "You do," she said. "If you wanted to go up in flames, you would have done it already." He grimaced. "You do not know what I want," he said. She leaned in, putting more weight on the wound, forcing his conscious mind to focus. "What are your gas lines rigged to?" she asked. "Where did you place your charges?" He laughed once, a broken sound. "You really think I'm going to walk you through disarming my work?" he said. "There is a bomb squad in the building," she said. "They will find the hardware. I need to know how much time they have. You help me, maybe you get out of this with enough arm function left to feed yourself." He swallowed, face slick with sweat now. "Bluff," he said. "You always did go for the noble angle." His head rolled slightly toward Emma. She was still breathing. Riley could see the rise and fall of her chest. Behind them, hands reached for the chair. Ward's voice rose tight and professional. "Get her upright. Watch her head. Let me see her pupils." "Bomb squad is 2 minutes out," Torres called from somewhere near the stacks. "They are following the pipe routes now." "Tell them to start under stacks B1, Riley said, without lifting her eyes from Reddick. He wanted an audience. He will have wired it close enough to watch. Torres relayed the information without argument. Reddick's breath came in short, angry bursts. "You cannot stop what is coming," he said. "Even if you walk out of this basement, it is already in motion. Deals signed, shipments routed. I am one spoke on a wheel." "Then we break the wheel one spoke at a time," Riley said. "You think someone like Hale had access to the real names?" he said. "He knew half the story at best. The men who built this machine sit in rooms you will never enter." "Maybe not," Riley said, "but you are the one bleeding on my boots." His gaze flicked down as if to confirm it. Blood had soaked into the fabric of her scrub pants, dark and warm. Emma groaned. The sound sliced through the air sharper than the gunshot. "Emma," Ward said, close now. "Do not try to sit up yet. You hit your head. Follow my finger." Riley kept her hand on Reddick's shoulder and his wrist. She wanted to look at Emma. She did not. "Listen to me," she said to Reddick. "If you drop that, they die first. Not the men in suits who signed your orders. Not the generals, not the CEOs. A student with ink on her fingers and a doctor who still scrubs in after 20 years. You add that to your list, or you draw the line here." He stared at her. In his eyes something shifted. Not remorse, calculation. "You really believe drawing lines matters," he said. "I believe you do not want your last thought to be that you killed my sister because you felt cornered," she said. "You are too proud for that." His mouth twisted. Pain and ego warped it into something ugly. "You always did understand your patients," he said. Footsteps came fast down the concrete steps. The air changed again, filling with another kind of urgency. "Bomb squad, a voice called. "We have the main shut off. We found 3 manual valves Reddick tagged in the maintenance room. We are working on the last one." "How long?" Torres shouted. "Give me 60 seconds, came the answer. Assuming he did not get creative with secondary lines. Reddick smiled with the corner of his mouth. "I always get creative," he whispered. Riley pressed harder on his shoulder. He hissed. "Stay with me," she said. "You pass out before they close those valves and we all turn to smoke." He met her eyes. For the first time she saw something like conflict there, warring with the pain and fanatic resolve. "You know what happens if I live," he said. "I talk, I go into a hole so deep the sun is a rumor. I do not talk, I still disappear. I was dead the day they gave me my first briefing." "You talk, you make sure the people above you disappear too," she said. "You do not, you carry their secrets into the dark, where no one can ever drag them out." He blinked slowly. You think Torres can protect you from them, he said. You think she can protect your sister. Riley did not answer. That was not a promise she could make even to herself. 15 seconds, someone called from the stairs. Last valve is almost there. Sweat rolled down the side of Reddick's face. It dripped into his hairline. His hand twitched once around the device. Riley tightened her fingers around his wrist, holding the tendons in place. He drew in a shaky breath. This is not your win, he said. It is not yours either, she replied. His eyes narrowed. He exhaled through clenched teeth. On the far side of the room, a shout went up. Valves closed, line pressure dropping. We are clear for disconnect. A wave of sound followed. Relief. Orders. The tension in the air shifted from imminent detonation to something one notch less sharp. Torres pushed through the cluster of bodies coming into view between the shelves. Her pistol was still in her hand, but the barrel was angled down. Riley, she said, you can let go. Riley shook her head slightly. You sure, she said. Abby just pinned the shut-off herself, Torres said. She stares at pressure gauges for a living. If she says we are safe, we are safe. Reddick laughed a cracked sound. You see, he said quietly, you get to be the hero today. Press will love you. Nightingale who saved the library. They will not print my name. They will, Torres said, many times. Under words you will not be able to read from where you are going. She nodded to a pair of bomb techs. They moved in carefully, one taking Reddick's wrist from Riley, the other slipping a hand under his to support the device as his grip loosened. On 3, one of them said softly, 1, 2, 3. They peeled his fingers away and took the device, moving it into a padded container with slow, practiced care. Riley finally let go. Her hands shook as she eased off the pressure on his wound, trading places with a medic who slid in with gauze and a pressure bandage. The muscles in her back protested as she straightened. Her knees complained about the time spent on the hard floor. She turned. Emma sat upright now, jaw clenched as Ward checked her pupils with a penlight. The tape had been peeled from her mouth, leaving a raw strip across her skin. Tears had left clean tracks down her cheeks. When she saw Riley, she broke. Riley? She said, voice ragged. Riley crossed the space between them faster than she would have thought possible. Her legs screamed. She ignored it. She wrapped her arms around Emma, careful of her head of the tape, residue of everything fragile. Emma clung back fingers, digging into the fabric of her scrubs. You are all right, Riley said into her hair. You are all right. Emma sobbed into her shoulder once then again. Torres stood a few feet away, watching them, radio in hand. Her face had lost some of its earlier hardness. Medical team is clearing the building now, she said into the mic. We have the primary suspect alive, hostage, recovered no civilian casualties. Repeat, no civilian casualties. Behind her, they loaded Reddick onto a stretcher restraints looping around his wrists and ankles. His eyes were open, fixed on the ceiling. Whatever he saw there, no one else in the room could. Cole appeared at the doorway, braced in the chair, one hand gripping the frame to steady himself. Ward must have given up trying to hold him back. He caught Riley's eye and managed a small, tired grin. Still do not leave anyone behind, he said. Riley held Emma a little tighter. They cleared the basement in layers. First the bomb techs and their gear, then the stretcher with Reddick flanked by agents and medics, then the librarians and staff who had huddled in offices upstairs herded out in trembling clusters. Riley stayed with Emma until Ward insisted on a proper exam. They moved to a quiet corner of the main floor, away from the raw hole in the floor, where a maintenance hatch stood open, guts of the old gas system exposed like a dissected animal. Emma sat on the edge of a reading table, legs dangling blanket around her shoulders. Her hair was mussed, the tape mark, a harsh stripe across her mouth, but her eyes were clearer now. She tracked Ward's penlight without flinching. Any nausea? Ward asked. She asked. A little, Emma said. Mostly feels like someone parked a truck on my skull. Ward nodded. Small contusion probably. We will get you scanned to be sure, but you are answering questions and your pupils behave. That is a good sign. Emma winced as Ward's fingers probed the back of her head. Ow, careful. If you wanted gentle, you picked the wrong sister, Ward said. Emma gave a shaky laugh. It cut off as she looked over Ward's shoulder at Riley. You knew this was about you, Emma said. 3 years ago, when you came home. It was not an accusation, not exactly. More like a puzzle piece snapping into place. Riley swallowed. The dried blood on her hands felt tacky. She could still smell Reddick's clone under the metallic tang. I knew people wanted me quiet, Riley said. I did not know how far they would go. Emma's fingers tightened in the blanket. You should have told me, Emma said. And what would you have done? Riley asked gently. Transferred schools, stopped walking alone, spent 3 years jumping at every shadow I did not see. Emma opened her mouth, closed it. The blanket slipped down one shoulder. I would have been less surprised to find a gun at my head in a basement, she said. Riley had no answer for that. Torres approached radio, still at her shoulder, a pair of plainclothes agents trailing behind. Her face looked more lined in the softer library light tension, carving fine creases between her brows. Medical update, she said. Concussion, minor head trauma, some bruising from the restraints, Ward said. Nothing life-threatening. I want imaging and observation. What about you? Torres asked Riley. Riley blinked. I am fine. I'm said. Ward snorted softly. She's running on adrenaline and stubbornness. We can patch her later. Torres nodded once. Reddick is stable enough for transport, she said. He is going to a federal facility under armed guard as soon as your people are done checking his shoulder. Hale is already in a holding cell downtown. Between the two of them and the audio we finally have enough threads to start pulling on the suits. Her eyes found Riley's. Which brings us to you, she said. Emma pulled the blanket tighter, suddenly alert. You are not taking her anywhere, Emma said. She just saved your agents and half this building. I'm not here to arrest your sister, Torres said. Quite the opposite. She motioned toward a quieter aisle between two shelves, away from lingering students and staff. Ward helped Emma off the table. You come too, Torres told Ward. I would rather have a doctor in the room when I drop this on them. They moved into the narrow canyon of books lit in uneven stripes by the overhead fluorescents. It smelled like dust glue and ink. Torres leaned one shoulder against the shelf, folding her arms. We have been working the weapons angle for 18 months, she said. We have manifests that do not match shipments. We have photos from overseas of guns that were supposed to be in storage. We have dead contractors and suspicious training accidents. Until today, what we did not have was anyone who saw the hand on the valve. Reddick, Riley said. Reddick, Torres confirmed. Your identification of him and Dalak put a name to the face in half a dozen blurry images Intel has been sitting on. Cole's testimony will fill in gaps from the operator side. Hale's recording ties the threats to a cover-up. Together that draws a line we can show to a judge, and maybe to a jury. She shifted the books behind her, creaking softly. But Reddick is not wrong about one thing, she went on. He is not the only one. This is an organized network that stretches from armories to congressional offices. He is a node, not the hub. Emma's hands tightened on the blanket. You are saying there are more of him, she said. I am saying that saying his name into a camera will make some very comfortable people very uncomfortable, Torres said. And they have ways of expressing their displeasure. Riley glanced toward the main doors. Through the leaded glass, she could see shapes moving outside the dark silhouettes of news vans, the bright square of a camera light. They already know something happened, she said. A student streamed the fire alarm on her social media before we even pulled the tape, Torres said. Somebody else caught the SWAT van on video. Half the city thinks there was a bomb scare at the library. The other half thinks there was a shooter. So far, nobody knows about you. That will not last, Emma said. Someone saw them roll Reddick out. Someone heard him talk. Torres nodded. We can manage the first wave, she said. Control the release. A short statement. No names, no call signs. But eventually this goes to court. Hearings, transcripts, leaks. People will want a face for the story. Riley rubbed her thumb over the edge of the bird sketch in her pocket. What are you asking, she said. I am not asking anything yet, Torres said. I am telling you the options. She held up a finger. Option 1, she said. We put you and Emma into protection. New names, new addresses, a town where nobody knows what Nightingale means except in poetry. Cole, too, when he is stable enough to travel. You testify by video where possible. When you have to appear in person, we wrap you in agents and move you like a fragile asset. Emma flinched. You would make us disappear, she said. We would move you somewhere safer, Torres said. That is the idea. And option 2, Riley asked. Option 2, you stay, Torres said. In San Diego or somewhere else, but under your own name. You cooperate publicly. You sit in hearings. You tell the story of Dalak as many times as we need. You become the person cameras point at when they say whistleblower or key witness. We still protect you, but we do it with the whole world watching instead of in the dark. Riley felt the weight of that settle on her shoulders. The word whistleblower, the idea of people dissecting her face on talk shows, turning her pain into debate fodder. What happens if we do nothing, Emma asked. If she refuses both? Then the investigation limps, Torres said. We can still hit some of them with the evidence we have, but without your testimony, Riley, and without Cole's, the case against the upper levels becomes circumstantial. They will take the plea deals, retire quietly, and show up on boards of defense contractors in a few years. The machine will slow down, then find new operators. Emma turned toward Riley. You do not owe them anything, Emma said. Not the operators, not the machine. You did your part. You got me out. You kept people from blowing up. The machine is not them, Riley said quietly. It is the kids who sign up because they believe the briefing packets. It is the medics who run out under fire because they think somebody up the chain values their lives. She thought of the young woman with the burned shoulder, of the Marine in the hoodie in the waiting room, of Cole's men lying in the valley. It is Ward, Riley added, 15 hours into a shift doing chest compressions on people she has never met. Ward made a small derisive sound. Do not drag me into your noble crisis, she said. I already have my hands full. You are part of it, Riley said. You always were. Ward's eyes softened just for a moment. Torres watched Riley saying nothing now, giving space for something to take shape. I hid for 3 years, Riley said. I let them tell me to be quiet. I let them turn my leg into an excuse to take my voice. That bought you some time, Emma. It bought you school and sketchbooks and late nights in basements you did not know were dangerous. Emma's eyes shone. She blinked hard. I do not want you to have to buy me anything anymore, Emma said. I cannot make that promise, Riley said, but I can decide what I am paying for. She looked at Torres. If I go public, you keep Emma covered, Riley said. For as long as it takes. You do not leave her alone in parking lots or stairwells. You do not assume a semester has gone by and everyone forgot. You make her safety part of whatever operation name you put on the paperwork. You have my word, Torres said. Your word, Riley repeated, not your agency's. I saw what agencies sign off on. Torres accepted the hit. My word, she said, and the resources that come with my badge for as long as I wear it. She will hold you to that, Ward said. So will I. Torres gave a small tired smile. I never doubted it, she said. And Cole, Riley added, he walked into this because of Dalek. He gets protection too. He was already on my list, Torres said. He made sure of that the minute he taped a recorder to his chest. Emma took a breath, then another slower this time. If you do this, she said to Riley, they will hate you. Some will, Riley said. Some will pretend not to. Some will call me crazy. Some will call me a traitor. Some will hang my picture on a wall for a while, then replace it with someone else. Why would you say yes to that? Emma asked. Riley thought of Reddick's voice in the basement. We are already dead. She thought of Hale's careful threats. She thought of Ward standing in the ER doorway, determined to hold the line with nothing but a clipboard. She thought of the purple ribbon shoved in the back of a drawer. Because I am tired of being quiet in other people's stories, Riley said. If they are going to write my name down, I would rather decide what it stands next to. Torres straightened. I will start the paperwork, she said. Media will ask for you before this day is over. We can say no for now. Once charges are filed, that changes. When we get to that bridge, you will have lawyers and handlers and all the other fun pieces of bureaucracy. She looked at Emma. And you, she said, get a security detail and a very patient agent who will shadow your classes while pretending to read the campus newspaper. Emma's mouth twisted. That sounds horrible, she said. It is less horrible than a red dot on your chest, Torres replied. Emma nodded once. Riley exhaled. It felt like air leaving a sealed room. One more thing, Riley said. Torres arched an eyebrow. When you talk to the press, Riley said, you do not call me a hero. You say I did my job. You say the people who died in that valley deserved someone who would not shut up about it. I can work with that, Torres said. A crackle from her radio pulled her attention. She tilted her head to listen. They are moving Reddick now, she said. We should not be here when the cameras catch up. Ward nodded. My vote is to go back to a building where I know where the bathrooms are, she said. And where the coffee, though terrible, is at least predictable. Emma slid off the table, fully testing her balance. She swayed, then steadied as Riley caught her elbow. You are coming home with me tonight, Riley said. Did you think I was going back to the dorm after this? Emma said. They can keep my plants. I never liked my roommate anyway. They made their way toward the main entrance together. The library looked different from the one Emma had entered that afternoon. Firefighters coiled hoses on the front lawn. Police tape fluttered at odd angles. Students stood in knots behind barricades, phones up, cameras ready. As Riley approached the doors, Ward slowed. This is your last chance to sneak out the side, Ward said quietly. Riley looked at the band of glass and wood in front of her. The door was propped open with a rubber wedge holding back the weight of the building. She could see the reflection of the patrol car lights, the bright spears of camera beams, the blinking red dot on a newscam's tally light. Red again. Outside, the sky was beginning to color toward evening. A cluster of gulls wheeled above the quad, their wings catching the last of the sun. Riley felt Emma's shoulder against hers. She felt the steady warmth of her alive and solid. I walked into a basement when the door was closed, Riley said. I can walk out of this one when it is open. Cole waited near the threshold, chair angled so he could see both inside and out. His face was pale, but his eyes were bright. "You sure about this?" he asked. "No," Riley said, "but I am going anyway." He nodded, as if that was the only answer that made sense. She stepped through the doorway. The noise swelled at once. Voices calling questions, some directed, some shouted at random. Flashes popped like miniature storms. The red light on the nearest camera glowed steady, a mechanical pupil. For a heartbeat, Riley considered ducking her head, hiding behind Ward's shoulder, letting Torres lift a hand and say, "No comments at this time." Instead, she stopped on the top step. She raised her chin. The breeze carried the faint smell of the ocean and the sharper tang of exhaust from idling vans. Somewhere a helicopter thumped past, circling. A reporter at the front of the crowd thrust a microphone toward her. "Ma'am, can you tell us what happened inside, Fab?" he asked. "Were you involved in the response?" Riley thought of Emma's drawing folded in her pocket. She thought of the valley, of the ER, of the red lights that had marked every threshold she had crossed today. "My name is Riley Hart," she said. "I was a medic in Afghanistan. I'm a nurse at Bayview. I was there when Captain Rivera's team was ambushed in Dalak. I was there today." The crowd quieted, cameras leaning in. "When the time is right," she said, "I will tell you everything I can. For now, I'm going to take my sister home." She stepped down the first stair, then the next, Emma close beside her. Ward and Cole followed, flanked by officers and agents. Above them, the gulls turned in the dimming light, their white bodies cutting clean lines across the sky. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.